What drew me to my specialty was I worked with a critical care group when I was in medical school. I actually went to be a neurologist, which is not what I do at all right now. But it was watching the intensivists in the ICU and how they just operated their day-to-day between their medical team, between how sick their patients were, because usually they're the sickest in the hospital. And most importantly, it was the way that they blended their teaching and their bedside manner all together in one. So I watched them in action, and they were far and away the most impressive doctors I ever saw in my life. That's kind of what made me make that shift between pursuing neurology and then kind of more focused on critical care. My approach to patient care really is taking a look at the patient as a whole and figuring out what are the most important things to them. Because treating a patient is very different than treating a disease, right? A disease doesn't quite care about finances, time, constraints. A disease isn't scared, doesn't have a bunch of questions. A disease isn't curious about other alternative options, you know? So it's really important for me when I sit with a patient to understand where are they in their health journey, so together we can make a plan that best suits them. The things that are most rewarding about my job, especially because I work in pulmonary medicine, is giving a patient their breath back, which sounds a little crazy, but it's really like giving them their ability to live again. Because if you can't breathe while you're just washing your clothes or going grocery shopping, it's pretty difficult to enjoy pretty much anything else in your life. So making that better for a person, just to where they can get up, they can be functional again, and they not have to worry about, do I have to sit down and rest every 2 minutes, is extremely rewarding.